Good morning, Ron.
Good morning.
This is the Valder Beebe Show, broadcasting live in Dallas, Texas. We're so excited to talk to you.
Good morning, Valder. It's a great pleasure to be with you and everybody in Dallas.
Well, I thank you. My audience is excited because I was talking about a recent study has found that nearly 2/3 of hospital patients give the nation's top hospital mediocre ratings. Tell me about that.
Well, I'd be happy to. We looked at the reviews of the top 20 hospitals in the country as determined by U.S. News and World Report magazine. They do a great service every year by ranking hospitals based on what we call clinical performance. How good is their doctoring, basically. And the top 20 is hospitals all over the country. They're exceptional institutions, no question about it. We also, however, looked at their reviews on Yelp.com, which, as you know, is a very popular business review website. You can rate restaurants, hotels, and hospitals and doctors and so on, any kind of business. And what we found was about 2,700 reviews of these top 20 hospitals. The average review was 3.2 stars out of a 5 possible. So that's very mediocre. And interestingly, nearly 2/3 of the reviewers, 62.7%, gave these top performing hospitals an average of 3.2 stars, and 84% said that their complaints were really not around how good the doctoring was, but around customer service. Issues like improper parking, difficulty finding where they were supposed to go, a frosty reception, and most of all, perhaps, the billing issues. People complained a lot about the billing.
Okay, I've got a Facebook post. You're talking their language because she said that she recently went to a large hospital in Dallas, and the intake operator was so rude they left and went to another hospital. And you just said customer service issues, right?
That's right, and I'm afraid this is an area that's been long neglected in healthcare. We've been so focused on getting people the best medicine possible that we've overlooked in this country basic customer service and politeness.
What are the biggest causes for this dissatisfaction that we're seeing? What's causing this?
Well, they really run the gamut in terms of the nature of complaints. There's everything from not getting a prompt response to a call button when you're in a hospital bed to there are some complaints about bedside manners. But the interesting part, I think, is that people by and large love their doctors. We've done other social media research and how people review and rate healthcare, and by 2 to 1, people give doctors more positive reviews than negative reviews. I think the problem is more the people around the doctors. And hospitals are large, bureaucratic institutions by and large, and they, I think, really struggle to maintain intramural kinds of communications and really get organized all around the entire patient experience from beginning to end. They can be very good at the operating room and recovery and so on, but we need to remember that the time you spend with a doctor in a hospital is a very small percentage of the entire time spent in the hospital.
That's right. The doctor is a ray of sunshine because you don't hardly see him. Okay, so how can we address these customer service issues? Is there any power for the consumer?
Absolutely. Well, in the large scale, we need to vote our consciousness. Healthcare has become, unfortunately, a very big political football. And there has to be a political solution. So I think we all need to be more active in making healthcare work for everybody at an affordable price. Secondly, I do say use social media for healthcare with a grain of salt. There is some good information on there. It's not scientific, these reviews, but by and large, you can get some good indicators about the quality of care you're going to get. And for hospitals specifically, I have several points. One is to avoid emergency rooms for everything except for emergencies. And that's because too many people crowd ERs with problems that can be addressed elsewhere. And there's lots of complaints about overcrowding, lack of hygiene, long waits, and so on in ERs. So avoid ERs. Secondly, if you are hospitalized, take a patient advocate with you, a loved one, a family member, or a friend, to go with you to be your second set of eyes and ears, especially if you're going to be sedated. I would also shop for hospitals carefully and look for alternatives to overnight hospital stays. There's lots of what we call ambulatory surgery centers now that can do fairly complex operations like total hip replacement as same-day surgery, so you can go home that day. You don't have to spend the night in the hospital. And lastly, I would say fight for your rights, and this is especially true in billing. Hospitals are notorious for overbilling and overcharging, and they are also quite surprisingly negotiable on some of these things. So stand up, make your voice heard, and be a good consumer.
That's a good point, Rod. Let me ask you, where can my audience get more information so that they can be an informed consumer, so that they can be a good consumer?
They can go to my firm's website, which is vanguardcommunications.net/hospital tips. vanguardcommunications.net/hospital tips.
Okay, Ron King, I want to thank you so much. And Ron is the author of The Totally Wired Doctor. Get yourself a copy and be a smart consumer also. Ron, thank you very much for being on the Valder Beebe Show. I think you've helped us a whole lot today.
Thank you, Valder, and I'm sorry about the Cowboys. They came so close.
We're not going to talk about that. I'll break out crying. Thank you so much,
Okay.
though.
Stay warm.